Hey guys! Welcome back to UWorld's Next Gen NCLEX review. My name is Nicole here with a post-operative question drill. If this is your first live that you've tuned in and first time seeing our question drill, how a question drill works is I will put up a question, give you about 30 seconds to read through it, think through it, and then drop your answers down in the chat. And then we will talk about why the right answers are right and the wrong answers are wrong, and get in the better practice of how to answer these NCLEX type questions. So we're going to be focusing on like priority and intervene and looking at those root words in the question so we can get in a better habit of answering these questions correctly. So if you are in the chat, love to see all your chats coming through. So hi everyone. Good to see you guys in the chat. I love for people to be active and to talk and give your answers in the chat. Don't be afraid. Don't be shy. And I'll give you guys some shout outs. We have Nurse Samantha in the chat moderating for me as well today. So if I go a little bit too fast on an explanation, or you just have a question, or you just want to talk, Nurse Samantha's in there to give her little feedback and whatever. So like I said, today's focus and topic is post-operative. A couple weeks ago we did perio-operative, so everything before, during, and after. But this time we're going to be doing and focusing on post-operative, so things after procedure, and a lot of client teaching, because a couple weeks ago we also asked what you guys would like to hear and some more topics, and client teaching is something that you guys think of or said. So plan of care is also very steadily in this question drill. So let's get started. Question number one. The nurse is caring for a client with a chest tube attached to a closed chest drainage system. Which of the following findings would be a priority to follow up? Option 1, intermittent bubbling observed in the water seal chamber. Option 2, crepitus around the insertion site. Option 3, serous drainage observed in the collection chamber. And option 4, a clamped drainage tubing. Let me know what you guys think. Oh, I have so many highs. Hi, hello to everybody in the chat today. Good to see everyone already talkative in here. Hello, everyone. Drop your answers down in the chat. Let me know what you guys think for this very first question. What you guys think? Oh, I have so many highs. Yes. To everybody in the chat. Lots of good answers. Good to see everyone. This one seems to be easy. I don't think I've seen a wrong answer yet. Very good. We're going to move on because people are just acing this question. It is option 4, a clamped drainage tubing. For anyone who has a closed chest drainage system, which is a chest tube, this helps to re-inflate a lung or the pleural space, or to drain out any excess fluid or drainage that is in the pleural cavity, to help re-expand that lung and re-expand and give that negative pressure back. So if the drainage tube is clamped, then that defeats the whole purpose of the drainage system. That means that that negative pressure is not being re-evaluated, and then that's a problem, and the drainage fluids and stuff is not going to be able to exit. So that defeats the whole purpose of the whole system. So we would want to definitely follow up. That is our priority in this case, to follow up and figure out why this drainage system is clamped, because that could be lead to a medical emergency. Options 1, 2, and 3 are all expected or can be expected findings of a chest tube drainage. You might see intermittent bubbling observed in the water seal chamber. This is sometimes seen like when a client takes a deep breath. Or if it's newly inserted, you have some intermittent bubbling seen. Crepitus around the insertion site, again, this is something that you would expect to see because it's a foreign object that is in the chest trying to drain something out. We would be more concerned if that crepitus starts spreading up into the neck and up into other areas. But around the insertion site is an expected finding. And then the serous drainage observed in the collection chamber, like I said, it's used to drain air and fluid. So serous drainage in the collection chamber is something that we would want to see, or an expected finding. So all those things are great, but if you see a clamped drainage tubing, that is something that you want to assess immediately, our priority. Let's move on to the next question. The nurse is observing a staff member caring for a client with an arterial line in the right upper extremity. The nurse should intervene if the staff member is observed doing what? Option 1, inserting a peripheral venous access device in the left upper extremity. Option 2, zeroing the transducer at the level of the phlebostatic axis. Option 3, monitoring the insertion site for warmth and erythema. And option 4, administering analgesics through the arterial line. Let me know what you guys think. And then also let me know what study topics that you guys would love for us to cover. So like I said a couple weeks ago, we asked what you guys would want. Some people said some client teaching and plan of care type of questions. So we try to incorporate that with our post-operative questions today. So let me know what you guys think or need help on, need study, focus on, and we'll go from there, as well as your right and correct answers for this one. Good job. Wait, I had to make sure. Yeah, we're on the right question. Good job, guys. Drop those answers in the chat. Good, 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 good. Any topics? I haven't seen any topics that anyone would like to see. Or are y'all, sorry, my Texan voice is coming out. Are y'all just smart and just know everything and y'all are good? Oh, there we go. Prioritization strategies, please. Yes. Cardiovascular. That's also a very good one. This morning during Samantha's live, someone said fetal heart monitoring. That's definitely something that I would not be doing. I am not an OB type of nurse, but Samantha is. So we're going to see if she can do something like that. Pediatrics, EKG. Yeah, I'm more of a cardiology type of nurse. So we can try to figure out a way to work those in as well. Correct answer for this one is option 4, administering analgesics through the arterial line. So let's go back to the question. So the question is asking about an arterial line in the right upper extremity, but it's saying the nurse should intervene. So we're looking for an action that is wrong, something that we would want to stop immediately because it can potentially cause harm to the client. So if a nurse is observing someone administering analgesics through the arterial line, this is something, yes, we definitely want to stop. Arterial line is something that we use to invasively measure blood pressure, and it's very sensitive, and we do monitor it, monitor the site for warmth and erythema because it can go bad basically very easily if it's not monitored quickly. If you have a blood pressure cuff on the same arm, if you start drawing labs from the same arm as well, you kind of treat it as a limb extremity. So if you administer analgesics or any medication basically through the arterial line, that is going to mess up the reading and mess up that arterial vein. So that is something that we do not want to do. All the other options, options 1, 2, and 3 are expected and things that you would want to do with an ART line. You want to place that peripheral or the other IV on the other extremity, so on the left upper extremity. You want to zero out the transducer at the phlebotic axis, which is kind of in your armpit area, and this kind of keeps it level with the heart so you can get accurate blood pressure readings. And then again, monitor the insertion site for warmth and erythema, just because it is a very sensitive line and it's a very invasive line. Things can go bad. It's a lot of blood going through that vessel. We don't want anything bad happening to that line. But you guys did very good. Good job, guys. Next question. The nurse is caring for a client with a closed wound drainage system. Which of the following actions should the nurse take? Select all that apply. Option 1, assess the insertion site daily. Option 2, strip the connection tubing once per shift. Option 3, document the color and consistency of the drainage. Option 4, secure the closed wound drainage system to the client's gown. And option 5, compress the bulb prior to attaching it to the connecting tube. Let me know what you guys think. If you're just joining in, we are doing post-operative question drill. So we're thinking about things afterwards, so lots of drains. But then we're also having some focus on plan of care, interventions, and what else did I say? I think that's it for the most part. And yeah, oh, I see a couple of people on YouTube saying that it's blurry. We will be working on that in just a few seconds. But you can just listen to my beautiful voice. We go live every Tuesday, Wednesday, and Thursday. So if you happen to miss or just coming in on this question drill, we go live and post some of these lives every Tuesday, Wednesday, and Thursday. Tuesdays, we go live with our lectures. And then Wednesdays and Thursdays, we have our question drill at 11 a.m. and 3 p.m. Central Time. And then on Tuesdays, the lecture is at noon. So you can always come back at those times. We do the same thing every day, or not every day, but on Wednesdays we do the same topic both at the 11 and at 3, same on Thursday. Good answer choices. This is a select all apply, so more than one right answer, and pretty much everyone got it. It is options 3, 4, and 5. So a closed wound drainage system in this case is we're thinking of like a bulb or a JP drain that is placed usually after procedure to kind of help pull all that excess fluid out from a certain cavity or certain space that they did the incision or did the procedure on. But we want to monitor that very closely because it is a drain and it is hanging from inside the client. So we want to document the color and consistency of the drainage. We want to make sure it's doing what it's supposed to be doing in that. If you don't see any drainage or if you see too much drainage, that is something that you want to notify the provider about. Secure the closed wound drainage to the client's gown. This is kind of our little safety hack that we have learned to do just so it doesn't dangle and hang off of the client, and that leads to a greater risk for it being dislodged from its place and causing more problems. So we kind of secure it with a safety pin to the client's gown so it doesn't hang freely. And then compress the bulb prior to attaching it to the connecting tube. So yes, with a JP drain or a bulb section or like even the accordion, you want to compress it so you can create that negative pressure before connecting it to the tubing or before closing it. So then when you release it, all that negative pressure will be coming straight from the drain and not from, or actually doing its purpose of the negative pressure. Options 1 and 2 are incorrect because option 1, assess the insertion site daily. We actually want to assess the site more frequently than that. Daily would be not even the minimum. You would want to do it at least once a shift, so that's at least twice a day. But depending on the provider's orders, or even just depending on the JP drain itself, you want to have more eyes on, or you want to put your eyes on it more frequently to make sure it is not draining too much at a time, or that it's having some type of drainage and doing its job, and just making sure it's not getting dislodged. So you want to assess it more frequently than daily. So that is why option 1 is incorrect. Then the reason why option 2 is incorrect, because we don't want to increase the risk. If you strip the connection tubing, you're increasing the risk of it getting dislodged or pulling the client's skin or pulling out from the specific area that the provider inserted it in. So you just want to avoid that at all costs in general. So option 1 and 2 are incorrect for safety reasons, but you guys did pretty good. The next question, the nurse is teaching a client who has a new prescription for a patient-controlled analgesia, a PCA pump. Which of the following information should the nurse include? Option 1, pain will be eliminated while receiving PCA. Option 2, continuous IV fluids will be connected to the PCA tubing. Option 3, medication is delivered each time the delivery button is pressed. And option 4, family members can push the delivery button while you are sleeping. Let me know what you guys think. Oh, I see a whole bunch of congratulations. Let me figure out who we're congratulating so I can give a shout out. We're saying congratulations to Gloria. I'm guessing you just passed your NCLEX, so good job, Gloria. Good for you. Welcome to the Nurse Life. Anyone else just recently passed their NCLEX or just scheduled to take your NCLEX? I'll give you a shout out. I love shouting people out. My next question, I'll ask on the next question. my favorite question to ask. But let me know if you just took your test or just scheduled. We have Miss Tamika on TikTok taking hers on Saturday. Good luck. You're almost there. Way to get one more study session in with us. Miss Anissa on TikTok is taking hers next Wednesday. Good luck to you as well. You got this, girls. You got this. Miss Hannah on TikTok is taking hers on the 19th. We got a lot of people on TikTok ready to take their test. I love to see it. Good, good, good. Offie on YouTube just scheduled theirs. Good luck whenever you're taking it. It's a mystery, but you got this. Miss Damiola took hers today. Good luck. I hope you can breathe now that it's over. You have like a weight lifted off of you. I hope you did well. I know you did well. You're tuning in with UWorld, so of course you did well. Okay, let's find the correct answer for this one, which is option 2. Continuous IV fluids will be connected to the PCA tubing. Okay, so the question says, which of the following should the nurse include? This means that the entire answer has to be correct. So not just part of it. It can't be maybe. Sometimes the entire answer choice has to be correct the entire time. So option 1, pain will be eliminated while receiving the PCA. This is not entirely true 100% of the time. It takes a while for those PCA medications to have that effect. So usually even in the very beginning, the pain will not be 100% eliminated while on the PCA. So that is the reason why option 1 would be incorrect, because it's not right 100% of the time. Option 3, medication is delivered each time the delivery button is pressed. Again, this is not done, or this is not correct 100% of the time. Each time the medication or the button is pressed, it can sometimes give you medication. There's usually a lockout period on the PCA, so you don't get too much medication in a certain time limit. So you could be pushing the button all you want, but you only get one medication administration in 10 minutes. That could be your lockout period. So you're not going to be getting that every single time it is pressed. So that is not 100% right. And then family members can push the delivery button while you are sleeping. Again, this is something that we would not want to teach the family or the patient to do, because this is something that we don't want to happen. And again, yeah, just a wrong answer. Option 2 is the only one that is completely right the entire time. Continuous IV fluids will be connected to the PCA tubing. This helps flush the medication in. So we usually have them connected to IV fluids going at a slower rate, but once that medication is pushed, it will help push the medication into your body so you're actually getting it. So this is a correct statement that is done 100% of the time. But you guys did great. Next question. We're flying through. The nurse is teaching a client who had surgery 12 hours ago how to use an incentive spirometer. Which of the following information should the nurse include? Option 1, raise the head of the bed to 45 degrees before using the device. Option 2, use the incentive spirometer once per day for 1 week. Option 3, clench the teeth on the mouthpiece of the incentive spirometer. And option 4, inhale slowly to raise the piston to the goal marker. Let me know what you guys think in the chat, please. And I guess now I can ask my favorite question of all times. If you guys tune in every week, you know what my favorite question is of all time, every single week. Where are you guys tuning in from? I love to see how far UWorld reaches. And this is when y'all get the most active in the chat. And you can see how far UWorld reaches and goes, and where everyone is tuning in from, how we're helping people from all over the world pass their NCLEX. So we have some Canada, Nigeria, Miami. Correct answer choices. California, Detroit, Canada, Oklahoma. We have a lot of Canada people today. Ghana, Nairobi, Texas, fellow Texan over here. Ify from Nigeria, Tampa, Florida, Tuni. I would right now. Beach somewhere. Zanzibar. Canada, Qatar, Brazil, okay, South America, Haiti, Gambia, Jordan, Eritrea, wow, that's the first time I've seen that one. Mexico, Australia, we got all the way to Australia. Shout out to you, Australia, Jamie in Australia. Okay, correct answers. Samantha will continue shouting you guys out in the chat because I love to take record of where we all go. Correct answer for this one is option 4. Inhale slowly to raise the piston to the goal marker. So the question is asking which of the following information should the nurse include? So we're looking for a correct statement. We're looking for a positively worded statement in here. So for this question, you would have to know how an incentive spirometer works. A lot of people just assume you blow on the incentive spirometer, but actually you inhale slowly to kind of help expand your lungs, and that helps raise the piston to whatever goal marker you are setting for yourself. So you actually inhale slowly, and that would be the correct teaching mechanism or correct teaching point for the incentive spirometer. Options 1, 2, and 3 are all incorrect teaching points for the incentive spirometer. Option 1, you actually want to sit them up 90-degree angle. So you want to sit them as straight as possible because this will have their lungs be able to expand to the fullest capacity and not work against gravity as much. Option 2, use the incentive spirometer once per day. That's a little too, not a little, that's a lot less than the provider would prescribe. Usually do it at least once per hour while you are awake. So definitely kind of the exact opposite. You want to do it a lot more to kind of help bring those lungs and re-expand and prevent atelectasis. Option 3, clench the teeth on the mouthpiece of the incentive spirometer. Again, you don't want to clench and bite down. You actually just want to softly create a seal with your lips around it and inhale slowly. If you clench down on it, you might collapse the tubing and that would give you an inaccurate reading. But you guys did great. Question 6. The nurse is caring for a client who had a percutaneous coronary intervention via the right femoral artery 15 minutes ago. Which of the following actions should the nurse take? Select all that apply. Option 1. Instruct the client to report changes in sensation to the right lower extremity. Option 2. Inform the client that back pain is expected following the procedure. Option 3, monitor the client's right pedal pulse every 15 minutes. Option 4, initiate continuous cardiac monitoring for the client. And option 5, place the client in the high Fowler's position. Which of the following actions should the nurse take? So again, another positively worded question. So we're looking for correct teaching points. Let me know. Oh, let's see what I'm missing in the chat. Some people from Kenya and Ghana. I like to get lost in the sauce, if you know what I mean. Let's see where else. Sierra Leone, Malawi. Oh, yep. Definitely got lost in the sauce. Let's go back to the bottom. Good job, guys. Lots of correct answer choices. Yes, more than one answer. Let me know what you guys think. Good, good, good. I'm pretty much seeing all the exact same answers. Maybe 1 or 2 off, but for the most part, everyone is saying 1, 3, and 4, which are the correct answers. So we're looking for positively worded or correct teaching points in this question or in the answer choices. So with a percutaneous coronary intervention, that is like a cath that they go in to look at your heart vessels to make sure there's no blockage. And they go in through pretty big arteries, which could be in the femoral or in the brachial or radial on your arm. And so there's certain teaching points that you should follow through after these procedures, which is to instruct the client to report any sensation or changes in sensation to the right lower extremity. In this case, since they went in through the femoral, you want to make sure, since it's going through the artery, that you are still getting adequate blood flow to the distal part of that extremity. So if they're starting to experience any numbness, tingling, or coolness to that extremity, that's something that we would want to notify the provider at, so they can make sure that there's not a clot forming or a hematoma. That is why option 1 is correct. Another correct teaching point is to monitor the client's right pedal pulse every 15 minutes. Again, that's a big artery. If that blood flow is constricted in whichever way, whether it be a hematoma, blood clot, or whatever, we need to be able to recirculate that blood and get blood flow to that extremity very soon and very quickly. And option 4, initiate continuous cardiac monitoring for the client. This is expected. It's usually probably was done even before the procedure because it is a heart type of procedure. So being on a cardiac monitor while they're going through a huge artery and a huge blood vessel, that's something that we would definitely want to do. Option 2 is incorrect. Inform the client that back pain is expected. This would actually be a complication. So if they're experiencing back pain, because they are going to be laying flat, which is option 5, they're not going to be in a high Fowler's position. They're going to be laying flat for a certain period of time just so they don't compress that blood vessel that they just went through. Blood can pool to their backside and cause pain, which is a complication that they have retroperitoneal pooling of blood. So that is something that we want to look out for and is not expected. That is a complication. And then again, the high Fowler position is the exact opposite of what we want to do. We want to have these clients laying flat for a significant amount of time. Last question of the day. The nurse is caring for a client who had a modified radical mastectomy of the right breast 8 hours ago. Which of the following actions should the nurse take? Option 1, allow the client's closed wound drainage system to hang freely. Option 2, place a safety alert bracelet on the client's left upper extremity. Option 3, obtain blood specimen from the client's left upper extremity. And option 4, encourage the client to sleep in the right lateral position. Which should they take? Last question of the day. Let me know what you guys think. And also let me know how many questions out of 7 today that you got right. And hopefully this one too. How many questions did you get right? And correct answers. Lots of correct answers. Or are we split on these answers? I'm seeing a good mixture of answers already. We're looking for a correctly worded, so that means everything in that answer choice has to be 100% right 100% of the time. No ifs, ands, or buts about it. A correctly, positively worded answer choice. Correct answer. We have a lot of mixtures of 2s and 3s. But the correct answer for this one is option 3, obtain blood specimen from the client's left upper extremity. So what is a radical mastectomy? A radical mastectomy is a surgical procedure where they go and take out the tissue in the right breast, as well as lymphs in that right breast area, usually after cancer has been found, to kind of eliminate all of that cancerous muscle or tissue from the area. And with that, since they're taking the lymph, that predisposes them to lymphedema and complications if they are poked or if they have circulation issues on that side, if they put a blood pressure cuff on that side. You want to have this or that side of extremity to be free of blood pressure, IV, and all that stuff, because their circulation is a little altered. So obtaining blood specimen from the client's left upper extremity, because this client had a right breast mastectomy, so you want to do everything on the opposite side. So obtaining the blood pressure cuff, obtaining blood specimens, all on the opposite side. Options 1, 2, and 4 would be doing things that would encourage, or that would be the opposite of what we would want to encourage. So option 1, allow the closed wound drainage system to hang freely. That is something that we don't want to do. One of our questions earlier, we want to secure it with a safety pin to the client's gown so it doesn't dislodge or hang. Place a safety alert bracelet on the client's left upper extremity. This is something that we would want to do on the right side, since the right side was the side that had the mastectomy. And then encourage the client to sleep in the right lateral position. You actually want them on the left side so that right side can have good flow and gravity is working with them to have the lymph and the fluid and the blood circulation to go down. So the only positively one, or the only good teaching point, is to obtain blood specimen in the left upper extremity, because that's the opposite side. So you had to read that one very, very carefully. But most of you guys did great. I hope you guys enjoyed the question drill today. I see a lot of people did 7 out of 8 and 8 out of 8, which is great. I hope you guys tune in to us next week, where we'll have another question drill on Wednesday and Thursday at 11 a.m. and 3 p.m. Central Time. And then also tune in to our lecture on Tuesday at 12 p.m. Central Time. You have a great weekend.